Hi, everyone. We have officially made it. No more technical difficulties. We are going to jump right in. My name's Hannah. I am our educational marketing consultant here at Family Source, and I am a one-time surrogate. I just delivered about a year ago. So I have that experience as well that will hopefully inform some of the conversation we're about to have here tonight. I'm joined here with Jordan and Alyssa, and they are going to share a little bit just to kick us off. Jordan, if you want to get started by telling us about kind of your professional background and also your connection with surrogacy in general.
Sounds golden. So my name's Jordan. I have been a nurse for 2.5 years. I've been in the medical field for like 16 to 17 years almost now. I've been with Family Source for almost a year. And when it comes to surrogacy, I am actually currently in my third surrogacy journey. My first one I did back in 2016. I delivered twins. My second was last summer, and then this one I'm currently 15 weeks with my first girl. Okay, only girl. I should say only girl. For Family Source, I do a lot of the like what we call phase 2 of our intake team. So we do a lot more like the medical reviews, communications with the clinics, things like that.
Perfect. And same question for you, Alyssa. If you can just introduce yourself and share a little bit about your experience professionally.
Awesome. Yeah. Like she said, my name is Alyssa. I've been a registered nurse for about 5 years now. Much like Jordan, I've been involved in women's health in some aspect for much, much longer than that. But my background as a nurse is in labor and delivery, postpartum recovery, and scrub nursing. Both professionally and personally have experienced infertility and some experience with that third party reproduction. And that's really what led me to a career with FSE. And so I do the same role as Jordan. We do a lot of those collecting medical records, reviewing records, and communicating with the surrogates and the fertility clinics while surrogates are matching and once they're matched.
Perfect. It is so nice to have both of you, again, given your professional backgrounds and, especially the personal experience that you have with, labor and delivery as well as surrogacy. So really excited to jump in. Tonight, we're talking specifically about delivery room expectations for intended parents, but really for anyone. So it's obviously a bit different in a surrogacy arrangement. So there are some specific things to consider when preparing really for that delivery room experience. We are live for the next 30 minutes or so. So if you are watching us live this evening, please feel free to put any questions or comments that you may have right in the chat. We'll be able to see those and we can respond to those live. So if you have any questions or anything like that, again, feel free to just put those in at any time. But I want to jump right in with a question about kind of the players in the room. So who is involved in the room in a surrogacy situation in the delivery room, and how does that differ then from what you might see in just a regular delivery?
Do you want to start or do you want me to start? I feel like you've got more hands in on this.
So, obviously you're going to generally have the same medical team involved, whether it's a regular delivery or a surrogacy delivery. What is a little bit different may be your support people, especially living in this COVID world where we're still kind of navigating some of those restrictions that facilities may have. That may look a little bit different. So the protocols are going to vary from facility to facility. However, most facilities would be comfortable with the surrogate having at least her support person, whether that's husband, partner, mother, friend. And typically they are also okay having both of the intended parents if that's the situation, or the single intended parent. I think it's very important to communicate about those things with your facility very early on and see what their protocols are, so that everyone is very familiar and knows exactly what that expectation is going forward, and also to see if that may change. Some facilities do different restrictions for flu season. Of course, with COVID, things like that, that they may change some of those restrictions along the way. It may be different in the beginning of your pregnancy versus when it's time to deliver. One good thing to mention, I think, that maybe intended parents have a question about is, does it look different for a vaginal delivery versus a C-section? And so in a vaginal delivery, typically you're able to have a few more support people, a few more people present. For a C-section, because it is a sterile environment, that may limit the amount of people that are able to be in the room. But again, that would be dependent on the facility. So I think it's great to have that conversation with the facility that the surrogate plans to deliver as soon as possible, to really know what that expectation is. Even if your surrogate does not plan to have a C-section, it's great to have that backup knowledge just in case that were to happen. So it is possible, based on the facility, that the surrogate may only be allowed one person in the delivery room. Hopefully that's not the case, and they would allow at least one of the intended parents, if not both, and the surrogate support person. But it's definitely great to have that information in place, know what the intended parents and the surrogates both desire in case that situation does arise.
So then, Jordan, if it does happen that there could only be one support person in the delivery room, let's say it's a C-section, do you find that surrogates are typically choosing their support partner? How is that decision? That sounds like a really hard decision to make.
It is a really hard decision. I think there's a lot of factors that go into that, because if you're close enough with your intended parent and they're already here, I don't see why that wouldn't be an option. But some people don't get that close with their intended parents, and so they choose to have their primary support person, whether that's their mom, sister, husband, boyfriend, whatever the situation is. Every facility is going to be different. I appreciate how Alyssa brought up flu season, because even with my own deliveries, I had to restrict myself to nobody under the age of 18 could even come visit us, and everybody had to wear masks, and I could only have a certain number of staff or family members come visit per 24 hours, like kind of similar to a lot of the COVID restrictions. But that was even prior to COVID.
Yeah.
And then there's also those considerations of like, is this a planned induction, or is this a oops, surprise, I'm in labor, we're having a baby? So being present can also play a factor into where are we in the journey, and was this planned? So
I think those are really good. There's just so much that you can't predict about labor and delivery. So I think being able to kind of plan for, okay, well, if this is the scenario, or if this is the scenario, they can be different things. So I know for me, I was able to also have a doula in the room. So that was really helpful as a surrogate, being able to have that resource for me. So, and actually she kind of was a resource then for my support person, and she was kind of involved in everybody's situations there. So I think that that's something also to consider, and, depending on preferences and things like that.
Yeah, I think that's a great idea. That's actually been kind of a growing thing within surrogate supplying, is asking, like, will this be something that the intended parents would be willing to cover and or be okay with in the room? Because for some people, that's like a make or break birthing experience. I think doulas play a big factor spiritually for somebody who's doing something like this. So if you find the intended parents who are also on board with that, I think it's a great experience overall in the delivery room.
Absolutely. I am getting over a cold, so apologies if I have to mute myself real quick, but we're going to be cool. So thinking about then, you mentioned like different labor and delivery scenarios. So can you talk through like the different stages of labor and when intended parents should anticipate even showing up?
See, this is also where it kind of gets varied. It can depend on, like, is a parent international and is planning to be in the area well before delivery actually happens? Or is this parent semi-local and they plan on flying out as soon as they hear, hey, we're heading to the hospital? The downfall is, even if you say, hey, I'm heading to the hospital, they could be sending you home. So kind of having an idea with your intended parents on what you plan is best. Most cases with the OBs or midwives, if you are planning for an induction, it makes it easier to plan because it's a surrogacy pregnancy, and that can benefit the intended parents overall. My most recent one personally was an induction because I had an international parent. He planned on coming like 3 weeks prior to the due date, and then we got to be induced, so he was only here for about a week and a half before we delivered. But then you can be like my first experience where it was not expected for my OB to be like, safety wise, we really should do this today. And then you're like, my parents aren't going to be here for like another 5 days. If this is your decision, you have to call them with me. So, like everybody's scenario is going to be different. Somebody's water could break in the middle of the night, and then you're trying to make emergency phone calls of like, hey, my water broke. I got to go do this situation. So phases of labor wise, that's where it can be variable across the board. Some women take days, hours to get through the labor process. Sometimes that can be quicker with an induction. But then there's also people that are like, no, I really want to go the more natural route. They're like 40 plus weeks pregnant. Their water never breaks. And then they're having to deal with all X, Y, and Z you don't know variables within labor. And either way, you could still end up in a C-section not knowing what could happen, whether that's natural, induced, or post dates. So I think it really comes down to having that conversation of, okay, well, if in this scenario, what do the intended parents want? And if you don't necessarily feel comfortable having that conversation with your intended parents directly, that's where we come in as an agency to chat with your case manager about having that conversation with your intended parents so that you feel more comfortable going into that as you get closer. I don't know if I fully answered that question, but that's where I went.
No,
I
Jordan,
think
I thought
so.
that was great
Yeah.
information. I was just going to say, I think, best case scenario, a lot of times surrogates do have a planned induction, which is great if everything goes perfectly to plan, and those intended parents can plan to be there whenever they've agreed with their surrogate that they would like that. I think that some intended parents like to be more hands-on, if you will, and some are okay with waiting until baby's actually here to be a little bit more involved. And so I think, like Jordan said, having that conversation early, whether it's directly between the intended parents and surrogate, or whether you kind of use the agency to bridge that gap and help have that conversation of, do you want your intended parents in the room with you the whole time that you're being induced for 2 days? Or would you be more comfortable if they waited a little while until you were getting a little more active into labor? So I think just having those conversations based on the relationship that you have with those intended parents and just what each individual's preferences are.
Mm-hmm. Yeah, I think you both answered it perfectly, honestly. It's just, I'm someone who's in labor for like 3 days, literally. So I know that that's something that, you plan for as much as you can plan for, but that's a very real possibility for some people. And so I think talking through who's going to be where and when, that's a lot of days of anticipation if that's how it's going to go down. So, so then who gets to choose the care providers as well as the hospital? Is that intended parents get to do that? Is that mostly on the surrogate? What does that look like?
So definitely the surrogate would choose which provider that she is comfortable with for her OB care and for delivery. There are a couple exceptions to that rule. So of course, if the surrogate and the intended parents had agreed on something different ahead of time, then that may change the plan a little bit. If that surrogate maybe needs high risk care and she was planning to originally deliver with a midwife, and she may not be a candidate to deliver with that midwife anymore, then that would again change that plan of care. She may need to see a different provider, maybe need to go to a different hospital that's able to care for a baby if they're planning for complications, maybe a preterm delivery. Those sorts of things may change that original plan. However, ultimately, assuming that everything goes smoothly, that surrogate is able to choose her providers. With that, I wanted to also throw in that if, as the surrogate, you are hoping to have an outside of hospital birth, that's also very important to bring to the intended parents, to bring to the table, to make sure it's in your profile, to make sure that it's talked about throughout the matching process during the match meeting, just to make sure that everyone is very much on the same page, since an outside of hospital birth is different. There's a few more considerations for that. So I think just being, although the surrogate gets to choose, being very open that if there is a medical complication, some other consideration that we need to take, that the surrogate's very open to maybe seeing a high risk provider and changing up that original plan.
Yeah, those are really good points too, because then one thing we ask within our applications or have in our profiles for our surrogates is, is your delivery hospital a level 3 NICU? And if it's not, then we have to label out how far away is the closest level 3 NICU to you. Because in some parents' minds, that's a big deal. Like, is my surrogate 20 minutes from a NICU level 3? Is it across the street from where she wants to deliver? Or is it 2.5 to 3 hours away? And I'm going to have to worry about if my baby's going to have some kind of issue. So really playing those factors and being knowledgeable about where you're delivering can make a big difference. My stipulation with my first journey, since it was high risk, being twins, I had to see both providers. I had to see an MFM consult, but I also got to see my own OB. Unfortunately, they didn't talk very well, so I was always filling each other in. But because I made it past a certain point, I no longer had to guarantee that I was delivering at one hospital. I could deliver at my own, but there was still that stipulation of if something was to occur or if there was something wrong with babies, that they knew where babies would be shipped off to be at the closest level NICU.
And I think that's important really for any, I know this specific topic is for intended parents, but I know that for, surrogates in particular, the idea is all about the baby's safety. So yes, surrogates can have their own interests and their own hopes and dreams for how this delivery is going to go. But really at the end of the day, it's about minimizing risk, which is really what the whole process is about. And so keeping that in mind, that it's not just an opportunity to get the delivery that you want necessarily, at least coming from a surrogate. I know that's something that's important that we talk to a lot of surrogates about. So, but on the flip side, I know, Alyssa, you'd spoken about out of hospital births. Some journeys do go that way, right? Where as long as the intended parents are okay with it and the surrogate's okay with it, and that's discussed right up at front, that is an option, it sounds like.
Absolutely. We definitely have some surrogates that prefer that. Maybe they delivered their own baby at home or at a birth center. And so some surrogates come in and they very strongly desire that. And again, we have some intended parents who are all for that, because that means they might have a little bit more of a personal experience. Maybe they also desire a little bit more of a hands-on experience. And so it really is all in what each party is comfortable with. And so I think that's wonderful to have that conversation up front, make sure everybody's really on the same page and comfortable with that. And also that the surrogate is comfortable with, again, changing the plan up if something comes up. They're very well educated that they will need to transfer to the hospital if those complications arise. Again, like you mentioned, just to have that healthy baby. That's the goal.
Mm-hmm. Yeah, I think that's all a good point. Now, let's talk specific logistics. So in the delivery room, baby's born, where does the baby go? Like physically, what are the options? How long does it take? What are those first few minutes immediately following the birth? If let's say a vaginal delivery.
Yeah, so vaginal delivery, typically every facility is going to be slightly different in their protocol. However, typically once that cord is cut, baby can either go under the warmer or even skin to skin with the intended parents. They can even arrange to recover for 2 hours that baby in a separate location. If the surrogate mother's I don't even want to see the baby, that's an option. It's just more of being forthcoming with the hospital that you're delivering at about what the expectation is once baby's out. most of the time, not all providers are able to like catch baby and keep baby and do all the things. So most of the time they'll at least put baby on surrogate mom's abdomen, do their dry and stimulating. Once cord is cut, they can remove baby. This is where it kind of gets to if the intended parents are present, if they want to do skin to skin as a nurse and a lactation consultant. Those are one of the highest like ranked things to be doing, to be bonding with your baby. So if they would like that, awesome. But if that intended parent is not necessarily one that wants to do that kind of bonding with their baby, also totally fine. Just making sure that the nursery nurse and or the baby catching nurse, some of the terms that they use in labor and delivery, are aware of what you prefer. So they're like, no, do all their meds, wait, do all the things that you need to do to be minimally interruptive later. They can just do all the things and then hand you your baby and just do their random checks throughout the time. So in my experience, it's been more of what do the intended parents want. My first delivery for my first surrogacy, the intended parents unfortunately didn't get to make it. So the delivery ended up happening urgently that same day. And then I ended up having the twins with me in my room with a nurse on staff, like pretty much in my room the whole time, for the first almost full 24 hours, because it's like a 19-hour commute from Europe. So yeah, I think overall just kind of knowing what their protocol is could play a factor. I don't know if Alyssa has more on the labor side to throw in.
I think you pretty much hit it. I think just, taking into consideration that most providers do this delayed cord clamping now, and so that can last a couple of minutes, maybe even a bit longer, just depending on how long it takes for that cord to stop pulsing. And so, like you mentioned, Jordan, it may be that baby goes up on the surrogate's abdomen or on her chest during that time while we're just we can't really hand baby off to intended parents yet. But really doing that delayed cord clamping that's really beneficial for baby. And so, you're still able to be very involved right there with baby as the intended parent, but just being aware that baby may not go to you the second baby is born. But like you mentioned, just having that discussion and know what the preference is, that as soon as baby is able to be in your arms, that's what you want. Or maybe you want baby to go to the warmer, or maybe you want baby to stay on the surrogate's chest for a little while they put a diaper on and do the hats and those sorts of things. So just being really upfront about what your preferences are with your care team is very key throughout most of these topics that we've talked about so far.
Mm-hmm. I absolutely agree. And I know that different hospitals obviously do things differently, but we were talking about the logistics behind if intended parents even get a special room afterwards. I know my hospital was able to do that, but that's something that you'll want to check in with your hospital on to see, especially during, obviously, postpartum, you may have a separate room, but even at the hospital that I was at, they were able to get a separate room in labor and delivery right when baby was born. So some hospitals are able to do that so that you're not just all sitting in the same room anymore. But there are, some things that have to happen medically to both surrogate and the baby then. So a little bit of patience there, but really after those first few minutes of making sure everybody's okay, we were at least able to get into separate rooms to really have our own separate care teams and get what we all needed, which were very different things in that moment, right? So I think that is a great conversation to be having with your hospital, and then between the intended parents and the surrogate. So
I completely agree. And as somebody who's kind of experienced both, my first journey, parents didn't get to make it to delivery, but they had their own separate room. And even though they hung out with me 90% of the time before I got discharged, they stayed an additional day and had their own privacy of getting all the education they needed from nurses. But then my second surrogacy, my intended parent obviously got to be there. However, they were so full, they barely had a room to move us to postpartum. So luckily we got one that had the double pull-out bed instead of a single pull-out bed. So both intended parents got to stay in the room with me, which I was totally fine with. it gave us all more opportunity to bond with baby, and support each other to like, hey, I got milk, here, you feed your baby, or you guys take a nap and I'll take a round of supervising. So just kind of being knowledgeable about what the hospital has to offer. The hospital that I worked at previously also had a program of like rooming in parents. So for either adoptions, surrogacies, or even like patients who had NICU babies that were planning on being there an extended period of time, they could arrange to like pay a flat rate amount where they would still get food for the night, but that they could stay in that room since they had a baby who was going to be staying longer.
Mm-hmm. And Jordan, you mentioned that your intended parents for one of the journeys was not able to be there for the birth. So what is that like? And especially for our international intent, I mean, it can happen to anyone. I've heard it happen to even folks locally, just depending on the situation. But for folks who may have to consider that a little more seriously as something that may happen, what are the types of preparations and conversations that should be happening in advance?
Most of them will definitely happen with your case manager. However, if it means much, I was admitted and there was still like pre-birth order paperwork that needed to be completed that I wasn't aware of. So the agency informed me with my first journey that I could not have any kind of medication that would relieve pain until after I had the lawyer stop by the hospital to finish our paperwork. Secondly, some things to consider would be like international parents, for example, what are their wishes for all of the vaccines? So like after baby's born, typically here it's protocol to do the erythromycin for baby's eyes. The Hep B series starts at day of life. And then the vitamin K, which helps with clotting. International parents, though, a lot of their medications might be at a different regimen. So like vitamin K might be oral instead of an injection. And so making sure that you are knowledgeable about what the intended parents' wishes are, because you shouldn't be signing any documentation for that baby, but letting the nursing staff know, no, they don't want any, or yes, they want all, or no, they want this one, but not that one. Being aware of that so that they can sign the proper documentation when they arrive, or wait till parents are there to perform those things. Along with, like plans for where they're staying. Are you going to be pumping milk for them while you're in the hospital? And what's the plan for when you're discharged? Because you can be discharged, but that doesn't necessarily mean the baby will be discharged right away, because it all depends on if your baby or babies are stable. And then those parents that are also taking over have to be deemed appropriately understanding of being a parent as well, which can be a challenge with language barriers from each country. So as a surrogate, I think it's just important to have a lot of the things that you would question about going to labor and delivery yourself, but acting as if they're still the intended parents' questions. So being more prepared, whether that's like at 20 weeks or 25 weeks when you reach more viability where anything can happen, just being knowledgeable about what their wishes are is always going to be the best way to go.
Yeah, I like the point that you shouldn't be speaking on behalf of anyone, but if you're, as the surrogate, the only one there at the hospital with the babies, it might be, good to know. What other decisions besides vaccinations would the intended parents be making for their child that they need to think about in advance? I know like bath is one that comes up a lot. Does baby need a bath? What is there research on that specifically?
So this is still like a gray area, and I'm happy to let Alyssa jump in, but we actually had this conversation earlier today because I had a feeling it's very controversial, and there's a lot of evidence-based studies going in both directions. Some are like, no, we don't do baths at all. So my first two children got baths. When I had my twins, they didn't offer a bath at the same facility. They changed their protocols and no longer recommended doing baths before discharge. When I moved to a different state and started working at a different hospital, they still did baths. But then there was like certain protocol we had to follow before we can give one, and then the protocol of like a timestamp of when we can no longer do like a tub bath, we could do a sponge bath. So knowing the facilities protocol on if they even perform baths on top of involving your intended parents, because maybe their culture or religion feels like that's an impure thing. So making sure that you understand what their feelings are towards having a bath, and ensuring that the staff know, hey, once that baby's out, parents do not want a bath, or they didn't make a comment, so it would definitely be a phone call to involve them of like, hey, we never talked about a bath. What would you guys like? Do you want them to just wash hair? Do you want them to do the whole thing? There's options for that.
It's a lot
Jordan,
to
I
think
think
about.
that's a great point. You know, when you think of not making those decisions for intended parents, you know, you don't need written consent to give a bath, but to intended parents, that might be a big deal. And so still involving them in something, there's nothing too small to involve that intended parent in, especially if they're not able to be present. So I really like that you mentioned calling them to see what their wishes are about a bath, because you may not think anything of it to go ahead and say, yes, give that baby a bath, but those intended parents may not want that. And like you mentioned, even if it's cultural reasons or just their personal preferences, you know, definitely if those intended parents aren't there, just making sure they get to be involved in all of those aspects that might seem really small to us or really small to a surrogate, but to an intended parent might be a bigger deal. So I really like that you mentioned that.
Especially like a first-time parent, because the way you just worded what, like paraphrasing my own words, made me think of like my intended parents for my first journey, the twins. Obviously, there's a lot of education on being first-time parents, let alone two babies. So getting that education from the nurses and the nursing staff on like, how do I hold my baby to wash their hair?
Yeah.
Maybe it's more of a, they want to be more involved with giving the bath versus telling somebody to do the bath. So
Yes,
Absolutely.
yes. Now, on that note, are there, and we're going to wrap up in just a minute here, but are there websites or resources that you recommend kind of as medical professionals that can help first-time parents or just intended parents in general learn more about what's kind of the right or more medically recommended things to do? Like, how do people even decide on this stuff and get actual information out there?
I don't really know of any like specific websites or anything. I'm happy to look into some that I feel like would be appropriate. But really, I think it'd be more about like getting involved. My international parents found programs in their area to do like a parenting class for newborns. My first intended parents, I believe they also did like a Lamaze class so they could understand delivery. There was a lot of like questioning on like, okay, well, can we come at this date? And I kept having to explain to them like, I'm not going to guarantee you that if you plan your flight on this day that you're going to make your delivery. Like, pregnancy is unexpected, delivery is unexpected. There's so many things out of control, especially with twins. You have to consider those higher risk possibilities of delivering early. So having them just get more involved, or even reading a book or their version of like what to expect when expecting. I know that the book is always going to be better than the movie. So even if it goes to, hey, watch the movie, I think that standard, whether you're adopting, doing surrogacy, having your own baby, really helps settle and give you an image of how delivery and pregnancy is something different across the board for everybody, and that there's no one way. You're going to go in with a plan where you want XYZ, and something could happen where you end up with ABC instead. So just feeling educated. Maybe even like a first aid class would be like the first aid CPR for newborn would be a good one.
Absolutely. I think just to keep touching on what you were saying, Jordan, just get involved locally, or potentially even if your IPs are local to where that surrogate is, getting involved with that hospital. Sometimes they have the birthing classes, like you mentioned, the infant CPR, because that can be really different. Even if you are certified to do adult CPR, maybe you need a little bit more education on infant CPR. And then always, when you're discharged from the hospital, make sure that you're asking any questions that you have. I know a lot of facilities, even the one that I came from, provided a big booklet so that you can reference back to any questions, or maybe you didn't even think to ask this question and now you're home with this new baby and you have no idea what to do. You can look back at your discharge paperwork, your discharge booklet, and really be able to find that answer, but also relying on the pediatrician as well. Hopefully, as the intended parent, you're able to be established with a pediatrician before delivery. If not, that's okay. But they're also a really great resource and could probably provide even more resources in those websites and different books and pamphlets and all kinds of great information. But definitely your pediatrician would be a great resource for any specific questions that you have, and maybe things that you think about even after you've gone home.
Yeah, I think bringing up the pediatrician is a huge point here, because I think when I'm thinking about the delivery room and the baby and all of those things, I'm thinking about people who are just at the hospital and, the labor and delivery nurses and the OB, but really your pediatrician will be able to be a resource for you even before baby's born. I think I have 2 kids, and that is not even something that I thought about until you mentioned that. So,
I thought, and one more idea, just to throw it out there, is asking the hospital that you prefer to deliver at if they're doing tours. In my area, I'm very rural Idaho. The big hospital in our area is not doing tours, but they have more experience with the higher volume, higher acuity patients. However, the smaller hospital that I prefer to go to dropped their gestational age, so they can take higher acuity babies just as much as the competitor across the street can. But they offer tours. So offering those tours and getting the education, they have an amazing lactation consultant who does those tours. So then you're kind of getting a mixture of all of the information you can get. So seeing if your facility does that, because maybe your intended parents come for the anatomy scan and you can try to schedule to go do a tour when they're in town, making them more comfortable with where we're going.
Yep. Or even my intended parents were local. We live 20 minutes from each other, and they'd never been to the hospital that I delivered at. So just getting them in there, even locally, I think is really important, even just to know where you're supposed to park, because on that day you're very overwhelmed and there's a lot to think about, and knowing where you can leave your car without getting ticketed is something that you need to think about before you go in for labor and delivery. So, and you mentioned all of the resources out there. I think you both on our team are an incredible resource to have here. So I know you're, sharing your wisdom and experience with all of the surrogates and intended parents, and we deeply value the experiences that you're sharing. So thank you. I want to be cognizant of everyone's time. I have so many more questions about this topic, so we will have to do a part 2, I think, specifically on delivery room, because there's just so much to cover. And maybe a podcast too. I think that would actually be a great idea, because again, this is something that we get asked about so much. There's so much anxiety and what ifs and questions from both intended parents and surrogates. So if you have questions about it, again, feel free to drop us a line. You can reach out to Jordan or Alyssa. Their contact information is on our website. And anytime you reach out, we'll be able to get back to you about those. But thanks everyone for watching tonight. Thank you, Jordan and Alyssa, for joining us. And we will be back with more, I think, on this very topic, because it's, I think, such an important one. So thank you for sharing everything that you have tonight.
Thank
Have
you.
a good night, everyone.
Thank you.
Yeah. Have a good one.